Well, on today's show, I want to take a look at some of the outbreaks that are going on in the country of Nigeria, one of the most populous countries on the planet. And the first outbreak I want to take a look at is yellow fever. And just about a couple months ago, they started reporting an outbreak of yellow fever in the Alkaleri local government area in Bauchi State. And so far, through mid-September, early October, there's been about 243 suspected cases, and there was 28 of those cases that were confirmed by real-time PCR, and 34 fatalities. Cases are not only found in Bauchi State, but they are also found in Borno, Kano, Gombe, and Katsina states, which have some kind of epidemiological link to Bauchi State. So that's been going on in Bauchi State. Kind of a pretty serious outbreak there. But Bauchi State is not alone. But just a little bit more information about the Bauchi State yellow fever outbreak. The World Health Organization calls the epicenter the Yankari Game Reserve in Alkaleri State, or Alkaleri LGA in Bauchi State. And it says, this is the first time that cases have been reported in relation to this area since the outbreak started in September 2017, when the yellow fever outbreak started in Nigeria more than 2 years ago. This is the first time it's been reported in this area of the country. It says this outbreak is unique in the broad geographic distribution of cases, most with linkage through travel, work, or residence in or close to the Yankari Game Reserve, which is an ecological zone highly prone to yellow fever virus circulation. And then it goes on to say in this report that this year, excluding Bauchi State, the first full 8 months, a total of 2,254 suspected yellow fever cases were reported through 535 LGAs, local government units, basically. All states, including the Federal Capital Territory, have reported at least one suspected case. And I believe there was several confirmed cases out of this large number. 37 confirmed cases were reported out of a number of states: Edo State, Ebonyi State, Ondo State, and several others. And a number of deaths, dozens of fatalities have been reported. The public health response includes routine yellow fever vaccination. This was introduced with Nigeria's expanded program on immunization back 15 years ago. But the overall population immunity in areas affected by the current outbreak remain below recognized herd immunity thresholds. A 4-year, starting in 2018 through 2021, National Yellow Fever Preventive Mass Vaccination Campaign plan, supported by the Global Alliance for Vaccines and Immunization, or Gavi, is currently being implemented to cover all states in the country. By 2025, it is anticipated that all the states in Nigeria will have conducted preventive mass vaccination campaign activities to protect at-risk populations against yellow fever. This year's phased preventive campaigns will target the following states: Anambra, Ekiti, Katsina, and Rivers, with specialized activities in Borno. If you're not familiar with yellow fever, it is a acute viral hemorrhagic disease transmitted by infected mosquitoes. It has the potential to spread rapidly and cause serious public health impact. There's no specific treatment, but it is preventable with a single dose of yellow fever vaccine, which provides immunity for life. If somebody does get yellow fever, supportive care is required to treat dehydration, respiratory failure, and fever. And so that's what I wanted to cover as far as yellow fever in Nigeria. And moving on to the next situation in Nigeria, and that's the monkeypox outbreak. And of course, monkeypox is a virus that's related to smallpox, albeit much less severe. And it says here in this latest report covering September 2019, Nigeria continues to report sporadic cases of monkeypox after the index case was reported 2 years ago, around September 2017. In September of this year, 15 new suspected cases were reported from 5 states, but 5 of those suspected cases of the 15 were confirmed positive for monkeypox, including 3 in Lagos, a massive city of 20 plus million people. Rivers State and Akwa Ibom also saw confirmed monkeypox cases. A handful of these suspected cases actually tested positive for chickenpox, and no fatalities were reported in September. So far this year, there's been 81 suspected cases, of which 39 have been confirmed in 9 different states, and there's been 1 death. So monkeypox is another issue that Nigeria is battling as we speak. One of the bigger outbreaks right now is the Lassa fever outbreak in Nigeria. And in the latest reporting week, which ended October 13th, they reported 5 new confirmed cases from Edo, Ondo, and Bauchi states. No new fatalities. So for 2019, they had just over 4,000 suspected cases reported from 23 of Nigerian states. 726 were confirmed positive. 19 are probable, and the rest have been ruled out as negative. In addition, since the outbreak started in 2019, there's been 154 fatalities in the confirmed cases, given a case fatality ratio just a hair above 21%. So that's going on. Lassa fever. Also, healthcare workers have been affected, and there's been at least 19 healthcare workers infected with Lassa fever during this outbreak from 10 different states. Next, cholera. Nigeria is also in the middle of a cholera outbreak. Particularly right now, it's Bauchi State. However, the good news is that appears to be in a declining trend. There was a few new cases reported recently. And since mid-May, through about mid-October, Nigeria has seen 787 cases and 4 fatalities of Vibrio cholera. One of the bigger stories in Nigeria, of course, and around the world right now is polio. And of course, earlier this week, we saw the historic announcement that wild poliovirus type 3 has been eradicated. So that is, all the wild polioviruses are pretty similar, right? However, this would be the second wild poliovirus that's been eradicated. Wild poliovirus 2 was eradicated several years ago. So those 2 polioviruses and smallpox are the only infectious agents that affect people that have been eradicated to date. So that's going on. So it says wild poliovirus 3 is the second strain of poliovirus to be wiped out following the certification of the eradication of wild poliovirus 2 in 2015. The last case of wild poliovirus 3 was detected in northern Nigeria in 2012. And then let's go down here and take a look at see what's going on with Nigeria. They're talking about, because wild poliovirus 1 is still present. There's 3 endemic countries: Pakistan, Afghanistan, and Nigeria. But it may be that Nigeria will be taken off that list in short order. And in this report from the Global Polio Eradication Initiative, it says, we do have good news from Africa. No wild poliovirus type 1 has been detected anywhere on the continent since 2016 in the face of ever improving surveillance. Although the region is affected by circulating vaccine-derived polioviruses, which must urgently be stopped, it does appear as if the continent is free of all wild polioviruses, a tremendous achievement, though this has not been confirmed at this point. It hasn't been announced that Nigeria is free, the last African country to have wild poliovirus. Moving right along, while there has not been any wild poliovirus in Nigeria in over 3 years, they are still reporting circulating vaccine-derived poliovirus 2 cases in the country. And so far, Nigeria has seen 16 cases. This is down from 34 seen all of 2018. Now, in this interesting report from a Nigerian news source called Punch, it's entitled 43,000 Nigerian children lack access to polio vaccines, according to the Gates Foundation. And this was an interview with one of their reporters with a gentleman named Dr. Chris Elias. He's the president of the Global Development Division with the Bill and Melinda Gates Foundation. And I'm just going to read a few paragraphs here that are pretty important. As recently as 5 or 6 years ago, we saw persistent cases of wild poliovirus in various parts of northern Nigeria. And we realized that what we were doing before wasn't enough. We were controlling it, but we were not succeeding at eradicating it. So, a couple of innovations, and probably one of the most important steps, was establishing the Emergency Operations Centers, where we brought all the partners working on the Global Polio Eradication Initiative together into one environment where they were working together side by side every day and looking at the same data all the time and looking at how best to respond and adjust the microplans for the campaign. The routes for the immunization and the vaccinators follow. The second approach was using data. So it was not just about doing campaigns, but actually following the quality of the campaigns. Did the campaigns reach all the children? So we did what is called quality assurance sampling after the campaigns to make sure that we understood where the coverage was and see if children had been missed. And some interesting information, we monitored even where children were not getting paralyzed, because for every paralyzed child from polio, there was probably 200 other children that had been infected but weren't showing signs of paralysis. It is only occasionally that it paralyzes a child. As we have come to the final cases, these environmental sampling combined with the consistent use of data to improve the quality of the campaign and the partnership model of getting everybody literally in the same room working together, in my opinion, are part of the innovations that made a difference. So 5 years ago, we saw the last cases in Kano State, and it looked like things were a go in Nigeria. And then they went without cases, wild poliovirus 1 cases for 2 years. And then several cases were reported in Borno State in 2016. He goes on to say, Elias goes on to say, we were not surprised when that happened because we knew that because of the insecurity and displacement of populations, we were missing kids. We knew these 3 years ago. We estimated that we were missing 460,000 children, and that's a lot of children. That is enough children to sustain an epidemic of polio transmission. Since 3 years ago, we have doubled our efforts. We strengthened our surveillance system and improved the quality of the campaigns, and we have really pushed to get access to these children, even in insecure areas. And you got to remember that some areas of northern Nigeria do have the Boko Haram and this kind of terrorist warfare situation going on up there, and it's hard for polio workers to get up there. Anyway, he goes on to say, as a consequence, today we estimate that we are only missing 43,000 children, as opposed to 10 times that with the 460,000 children before. That is a tenth of the children that we were missing 3 years ago, and the quality of the campaigns has gone up. So there's a lot of good work going on in Nigeria, trying to put an end to wild poliovirus for good. So we'll be keeping a very close eye on that. So we've looked at yellow fever outbreaks, monkeypox, Lassa fever. We talked a little about poliovirus. And lastly, I just want to point this out. And this is from another Nigerian news source called Pulse. And the Minister of Health of Germany had some kind words to say about Nigeria's preparedness against infectious disease epidemics. And if you go back, 2014-ish, Nigeria did a yeoman's job of preventing Ebola from spreading in the country. They ended up having, a couple dozen cases instead of the disaster that we saw in the countries to the west. Anyway, his name is Mr. Jens Spahn. He's the Minister of Health for Germany, and he commended the efforts made by the Nigerian government through the Nigerian CDC to prepare the country for possible outbreak of infectious disease epidemics. And Spahn made the commendation during a meeting with the Director General of the Nigerian CDC and recently in Abuja. And he said, quote, "We are in this together. It is very encouraging to note that your structure and preparedness for infectious diseases. It is not just about Ebola or polio. It is about building the capacity for all infectious diseases," he said. And then he also encouraged the Nigerian CDC to work closely with the African CDC on continuing to improve the surveillance and the work against infectious diseases in the country. So that's what we have here on Nigeria. There's a lot of stuff going on there. They appear to be doing a pretty good job on a lot of these outbreaks. So to find out more about Nigeria, you can check out some of our stories at the website outbreaknewstoday.com. We keep a pretty close eye on that country. And if you like the video, again, like it, subscribe to the channel, comment below, share it with your friends, and I'll see you next time.